Well, good morning and welcome. It is Tuesday. It's a beautiful day. It's a wonderful day this morning. I don't know something about this morning. Well, maybe it's me. I woke up in a really high spirit. I'm feeling very happy. Happiness is part of the morning, and I'm glad because it's not every morning. Sometimes you wake up and the little pestilence gets you first, and when you catch you first, you feel heavy. You're walking out. You're really not walking, but you're actually dragging yourself out of the house. You know that kind of spirit. So he didn't catch me he didn't catch me lagging this morning. So I caught him before he caught me today, and I feel accomplished. So I am very elated to have that spirit to be able to present to you today, because that's a vital thing, Every morning you wouldn't have it together, but it helps to know that somebody along the way, that's how the design was, Somebody, when you don't have it, is going to pick up where you're lacking. And that's the beautiful thing about life. That's how life was meant to be, that sort of way. When you're down, I'm up, and I'm going to pull you up. When I'm down, you up, and you're going to pull me up. That's how it works. But this morning we've got a wonderful program set out. We've got a beautiful and amazing St. Lucian daughter in the seat with us, and we're so happy that she decided to join us with her story, her journey. That is what the program is about, highlighting persons, or women rather, amongst us who, their journey in some way, somehow could inspire somebody else that is probably on the same path, or probably whatever path you are on, is to show that, listen, man, it is doable. Whatever that is, it's doable. You understand? Whatever the field, whatever the challenge, whatever it is that you want to pursue, it is doable. And that is why we are so grateful to have had this program designed just for that. And we are even more grateful that we have somebody, a partner, who understands that vision and has decided to back that program in that of the First National Bank. So we thank them, and we'd like to take a word from them. When we come back, we get straight into the program. We've got our guest on the inside. She's Dr. Asha Mareen. She will be joining us. And we also are live. We're live on our Facebook page, the official page of Radio Caribbean International, and we're also live on our YouTube channel. So you want to go on over there. If you want to get a little bit up close and personal with the show, you can absolutely do that. Or if you're listening via the frequency, then that's fine too. All right, a word from the partner.
All started with a penny. For over 85 years, we have invested in our farmers, fishermen, people, and our country. When we were called to serve, we were here. We understand what is valuable to our people and our country. That is why we support all industries, including tourism. We are the bridge towards a brighter future and economic growth. When our people, government, and businesses called upon us, we were here. 85 years later, First National Bank St. Lucia Limited is here for you.
Wonderful, and here we are back. Those of you who are joining us, we are grateful to have you on board with us this morning. Let me go into the comment section, because I see comments that have come through already. I know it's going to be one of those mornings. Solange, good morning to you, and thank you for joining us so early as part of the show. This morning, like I mentioned, we've got a remarkable guest in that of Dr. Asha Mareen. Now, she's reminding me she's not a born St. Lucian, but I just reminded her, you're here contributing like I am, so we are Lucians. Dr. Mareen, good morning.
Hi, good morning.
It's an honor to have you, man.
Thank you so much for having me.
Absolutely. Well, you know how we normally do the things. Well, probably you don't know, but I'm going to break it down to you right now.
Break it down for me.
We're going back, because since you have things to tell us, we want to find out where all this started. I'm understanding you're from Dominica.
Yes, I am.
Wonderful. Tell me about childhood in Dominica. What was it like? What kind of household? What were some of the principles that you believe grounded you and contributes to the person that you are today?
Okay. Well, once again, just before I start, I just want to say thank you very much to RCI for having me here. And, God bless to you guys for giving us a platform from which we can speak. And blessings to all St. Lucians and the wider Caribbean people listening.
Absolutely.
So, yes, I am from Dominica, the Commonwealth of Dominica. I was born in the capital, Roseau, like most people, but I usually say that I'm from Masak. I know you guys call it Masque here, but we pronounce it Masak. So, so we have a lot of village names in common, actually, between Dominica and St. Lucia, just different pronunciations. So yes, I am from the village of Masak, which is like around 10-15 minutes outside of town. I grew up there with my mom. I grew up in a single family home with a single parent in a single parent home. So my mom has been most, if not everything that, is my identifier as my foundation. That came from my mother. She was she had me at 25. And it was us, the two of us against the world. And I am.
Okay.
Of my mother's. I'm my mother's only child. My father has more, but I'm my mother's only child. And yes, and I mean, from very, very young, she exposed me to a lot of things that I felt were integral in molding me into the woman that I am today. Music, the arts, religion, not just religion in the conventional sense of religion, even though she raised me to be a practicing Catholic, but more faith. And putting out good out there and doing good out there. My mother definitely epitomized that. And, a focus on academics as well. So I went to the St. Martin's Primary School and then was privileged enough to earn a scholarship in what used to be called the Common Entrance exams back in the day. And I went to convent, so I'm a convent girl.
You're a convent girl.
I'm a convent girl.
Them SJC girls, let me tell you, it's a community,
Yeah,
no matter what
it's a
island.
sorority. Convent girls to the world. Literally. So yes, so I'm a convent girl, and that was very important. From very young, I had identified that I wanted to be a physician. My mother gives a story of me being very, very young and my dad asking me what I wanted to do. And I said, doctor. I don't remember that at all, but but that's what she says, and we're going with that.
Well, you are one now,
Yes. So I stuck with it, went to A-levels at home, and then I did my first degree, my undergrad in Cuba, actually.
Ooh.
Yes, so I spent 7 years in Cuba, and that definitely, I must say, when I went to Cuba, I was 19, never having been from my mother's bosom, and I was thrust into Cuba, and that grew me. That definitely matured me. It let me know that I could do a lot more than I thought I could do, that I could tolerate a lot more than I thought I could. And I definitely became an adult in Cuba.
You grew up.
I grew up. I grew up. I went up there a child, but I left a woman. In terms of maturity. And while there, I made a lot of very deep and lasting friendships. That's where I met a lot of St. Lucians, actually. Dr. Merle Clark, Dr. Jenny Isaac. All of us went up together, and there are more. Don't feel bad if I forget the name. If you know me, you know Asha has a poor memory for names. And then, those friendships have been maintained throughout the years. I went home upon completion. I worked for a little while, and that is where I really got my first deep dive and immersion into hematology and oncology. Because at the time, I didn't know what I wanted to specialize in. I knew it was something clinical because I couldn't handle hours on my feet in the surgical theater. God bless them. But no, that I recognized early on that was not for me. Pediatrics, I love kids, but the parents can be a lot. So So again, I also recognize that no, that wasn't for me. Obs and gynae, it never really spoke to me in that way, and I honestly think that I always say that being a physician is a vocation. You have to feel called to it because it asks so much out of you that it has to be that you're doing it for more than material things, right? Like a genuine vocation. And then when you're thinking about what you're specializing in, I always advise junior physicians, you need to understand that you need to choose something that you're going to do even when you don't feel like doing it. right?
That makes the world of difference there.
Yeah, even when you don't feel like doing it, you have to choose something that inspires you, something that excites you, something that you're still enthusiastic to continue learning about. Because science, in particular medicine, is ever evolving. I mean, I can go to bed and when I get up, my inbox is filled with the latest this and the latest that have just come out. So you have to be motivated to continue to learn and improve and bring to it an energy, because you're dealing with people, you're dealing with patients, and they feed off the energy that you give them. And the non-physical, the metaphysical, for want of a better phrase, carries as much weight, and sometimes even more. Like, people will tell you, I don't like the vibe. I can't tell you why I didn't like that person, but the vibe just wasn't there, right? And as a physician, when patients are in their most vulnerable state, so you have to come with a good vibe, a good energy, right? And doing something that you love will ensure that even on the days when your personal energy is down, you can find it. Yeah. So when I finished med school and I was home working as a junior physician, that's when I got my first real immersion into oncology and hematology, aka cancer and blood. And when that happened, so I was essentially the only other physician in that clinic. We used to have a once a week clinic where we did everything. So we would start from early in the morning and leave into the night, because we were seeing all the cancer patients, mixing medication, giving treatment, dealing with the hematology patients, all sorts of things. And even though I was physically tired, I felt mentally inspired. So as a result of that, that's when I was like, oh, no, I know what I want to do. I know what I want to do. Yeah, I know what I want to do.
Absolutely.
Right. So then I had to, because I had graduated from Cuba, and I wanted to remain in the region, because I was never too fascinated and dazzled by leaving the region and going abroad to the States or Canada or Europe, because I wanted to remain where I felt that I could give the most back and the most impact. Wow. And so I didn't necessarily want to return to Cuba, because I felt I needed a slightly different perspective. And so I did my CAMC exams. I passed the first time. God, that was difficult.
You did it.
But I did it, and I got into the program at the only campus that does it in the English-speaking Caribbean, which is at the Mona campus at the University of West Indies. That's in Jamaica. Yeah. And I started my program there in 2011. And let me tell you something. Everything I thought I knew, I did not. Anything.
So you had to go back and
I had to
study
go,
again?
yes, I had to go back and study.
To zero in on what you did. So you had to go and do that full specialization in that field now.
Yeah, so that's how I ended up in Jamaica in 2011. And and I finished eventually. It took me longer than conventionally, because it was supposed to be a 5.5-year program. It took me significantly longer. I didn't finish not until it took me over 7 years to complete. Because during that time, you know, when you're raised, I had always been an academic. Right? And then, so even though sometimes you'd have to kind of buckle down and kind of study, I always got through. You understand? I always made it, and, you know, slightly above average, sometimes higher than that, but, you know, never really failing at anything. And when I got there, that was the first time I ever failed an exam in my life.
It was a personal. Oh, my.
That was the first time I ever.
You were defeated.
It really kind of it when you have something that you consider to be an identifier.
Yes.
With more, like, you know, your intellect. Yeah. Or, you know, the fact that your academic prowess, for want of a better phrase, and then that is shaken to the core.
Oh my God.
That required
what life lesson? What are you walking? What life lesson? Because that can go across the board.
Yes,
that can be a life lesson for a lot of people.
I learned so much about myself through failure, for having had to go through failure, than having essentially usually always succeeded at what I put my mind to. I could just like meds it out, and I would get through, because I'm very goal oriented, right? And once I put my focus on something, I had never not achieved it. And then this was the first time that I had gone and actually desperately wanted to do something. And the methods that used to work for me just didn't work. It required a complete reorientation as to how I was approaching the problem. Right. And it was hard. It was sobering. And but I did it eventually, and I came out, and I think I came out a much better physician for it.
Right. Do you understand why that was the most high doing? You know that. By now, you know that.
Yeah. In retrospect. In retrospect, I met it out the lesson. But when you're going through the fire, all you feel is the heat. Right? You don't feel yourself being molded. And there's so many
people who stop there.
Oh yeah.
And give up at that point.
Yeah.
So I'm glad that you're here and you actually faced this. And from that trajectory, you were always winning. There's people out there who don't know what a no is or don't know yet. So, and sometimes they have to get to understand what it is, because life is going to be, you're going to go out there and life is different.
Yeah, you see it, and you have to experience it. And sometimes you would wish that major life lessons weren't so painful. But at the same time, you never get more than you can handle.
Absolutely.
And that's when you kind of have to fall back. Again, remember I said my mother gave me a lot of foundation in terms of like faith and personal strength, spiritual strength. So you have to have
some level to appreciate this a little bit more.
Yeah.
Now that you've gone past it and you overcame that failure and you're now here and you're doing very well, what would you say? Do you have now a better appreciation for what it brought? Now that you're out of it.
Yes.
Do you understand it was necessary?
I do understand that it was necessary. I do understand that.
What was the teaching out of it? What was the lesson supposed to be for you personally out of that? Because there would have had to have been a lesson.
There were multiple lessons.
Okay.
Honestly, there were multiple lessons. It was an entire syllabus.
Oh my. Oh my. All right. Well, give us that.
Facts. I mean, okay. So from an academic standpoint, it showed me that I could not just get by on trying to brute force it. I had to genuinely understand the subject, the topic. I could not just try to soak it and then hope I can keep it in time for the exam and spit it back out, right? It required an in-depth understanding. And when I recognized that, that's when I learned one of the basic tenets of learning anything. Yeah. If you can teach it, then you know it.
Then you know it. Absolutely.
If you can teach it, then you know it.
Absolutely.
So then what I actually ended up starting to do was that the junior consultants in training that were coming up after me, I then started teaching them. So that helped me to solidify and to understand what I knew, and most importantly, to understand what I did not know.
Oh gosh.
Right? So I mean that was a major academic turning point for me. And that even to this day, even with my junior physicians now, when I'm speaking to them and I'm teaching them something and I'm teasing it out, and even with the interactions with my patients, I can break it down to a layman's level because I understand it. Right? So yeah. So that was very important. I mean, and I think that is the main academic lesson that I learned through all of that. Personally, I think I learned that, it's not enough to just always go it alone and to try to just suck it up, stiff up a lip kind of thing. Very British of us. Very British of us. To just kind of suck it in. I learned that I had to ask for help. And it wasn't necessarily help with the subject, but just support. So I had extremely good friends up there that have become family, that are really my family, my chosen family. And they helped me navigate a lot, because a lot of learning is also, mental, not just mental in the academic sense, but, any sort of psychological, let me put it that way. So I had to work through things that clearly I had been carrying for a while that had now become a block.
Right.
And then that's why I am a great advocate. I will always be an advocate for therapy. I think most, if not all of us, would benefit from once in a while, ever so often, just go in and sit down on the couch of somebody that has a knowledge of how to navigate psychology, that is a non-interested party. So it's not like a family or a friend, but someone that can just really help that. So I actually went through therapy as well, but not because I had any major anything, but because it helped to be able to speak about and break down those barriers that I was not aware were existing. I mean, you hear these buzzwords about generational trauma and all sorts of things, and they're real. It's true. So I mean, that also, I got to know a lot about myself personally.
Would you recommend persons who into field of career that are vocational, that are where they are called to serve, where they're constantly dealing with people, with emotional, thing? Would you recommend that
definitely
go through that process?
I mean, to the point where I almost think it should be somewhat mandatory. Because again, just speaking as a physician, we take a lot. We absorb a lot. I mean, I'm an oncologist and a hematologist. Most of my practice is based in oncology, aka cancer care. That's heavy.
It is.
That tends to be very, very heavy, even though people always ask me, oh my God, how you can do something so depressing? I don't find it depressing, because the reality of the situation is that I am able to help people achieve the goal that they want to achieve. Each patient's goal is different. And if I can get them to that goal, then we've achieved success. Because it could be that the 85-year-old grandmother that was just diagnosed with something, all she wants to do is see her grandchild get married.
Yeah.
And the wedding is in 3 months. Help me get there.
Absolutely.
And then afterwards, we'll see what else we're doing. If I can get mama there, it's accomplished.
Absolutely.
And also, to a lot more of the patients end up going into remission than is seen. It's just that, unfortunately for us, is that when our patients end up coming to hospital for admission, it's very dramatic. And they're usually, unfortunately, on their last legs. And then my role now is to help them to come to terms with that transition and to afford them the dignity that they need to go peacefully, and to also help their family and their support system to a path of acceptance, so that when the inevitable does happen, it's with peace and with calm. So my interpretation of success is very different than, say, a surgeon or somebody like that. Right? It's very, very patient specific.
And you've got to be sure that you yourself
and
very well
and to do that,
able to do that. It's like you say, it's heavy. It's a
heavy.
lot.
It's heavy. And sometimes, I have a 5-year-old. I also have a daughter.
Oh, congrats.
And she's here in St. Lucia with me. So
Great.
yes. So, I have to, it's not just about ensuring that I have enough to give to my patients. I also have to retain some to give to her. And then some for me.
Well, of course. Of course.
Me.
Of course. Very much so. Yes. Right. Now, you're here in St. Lucia now.
Yes.
Oh, God, I could sit with you for an entire day. I can. I'm here. I'm all drawn in. So your purpose is definitely being worked out, because you are so inspiring. Just by listening to you, I'm sitting here and I'm I want to talk to you for the entire day, but you have patience to go back to. So I can't be selfish now. We got to share.
It's all right. It's all right.
We've got to see that passion. I am not surprised that you're part of that drive coming up on the weekend for blood, because look, I can feel that passion with a professional so passionate. I could understand why you're part of that blood drive on the weekend. Now, let's talk about that a little bit before we segue into that a little bit. Because we have a blood drive that is coming on.
Yes,
and I
we
want to
do.
tap into that right there where you're speaking so much about a vocation and being driven and being passionate about what it is that you're doing.
Right.
And not just passionate in terms of saying it, but leading by example.
Exactly.
And you're certainly someone that is doing so. So, our blood bank is our blood source is depleted.
Oh, definitely.
Depleted.
Yes.
I've been told. And we're heading into a carnival season where a lot more things.
We know what happens.
We know what
during-
happens.
Do we know what happens during carnival?
Exactly.
So,
And we going in. We cannot afford to be going in with a depleted.
I totally agree. So, I mean, the whole. Let's put it this way. The urgency for the blood drive this weekend is, of course, for us to ensure that we have appropriate products for what is historically, and we know why, people, we know why.
We know why.
Right?
Let's not pretend.
Let's not pretend. Let's be honest here.
Let's be honest with ourselves.
So historically is a very high accident prone season.
Yeah.
Right? Now I want to so we definitely need products, and it would be that we would be asking for significantly more products from a bank that is already running low.
Yeah.
So that is why this weekend is so urgent, and the importance needs to be highlighted.
Yeah.
However, there's certain things that I just want people to understand about blood and blood banking,
Yes.
and why having sufficient samples, having sufficient products is so important, not just seasonally,
Yeah.
but just as a whole for the country, in order to secure our health island-wide. So let me just throw out a couple statistics there. I wrote them down because I thought that they were just so
It's
impactful.
important. It's very important.
And I
as
wanted
well.
to make sure that I didn't fudge it up.
Right.
Right? So first of all, the WHO recommends that at minimum a country should have, our annual donations should equate to about 2% of the population. And best case scenario, around 4 to 5% of the population. At 2% for St. Lucia, that would mean 3,600 effective donations annually.
Wow.
Now, what does effective mean? Effective donations is a donor that was able to complete the donation, not just somebody who came to the drive, we tested them, and we were like, sorry, brethren, you can't give blood, or that sort of thing. It's somebody who was able to complete the donation, and that unit that we got from that person is appropriate and safe, and then all testing that we did on it was negative, and that unit is now part of the bank for use, right? We are barely scratching 3,000 in total donations. And of that 3,000 in total donations, a significant amount of them cannot be placed into the bank for whatever reason, right? Now, something that I think I say St. Lucians, but this is really, this is a Caribbean problem. Yeah. Something that we need to understand, and I think we really do need to do better as a people, is that over 15 years ago, approximately 80% of all donations were altruistic, meaning that there were people who were donating voluntarily, people who were donating for the greater good, people who saw it as part of their civic duty, as a way to ensure the health of their country. They would donate regularly every 3 to 4 months. So this would be people who would be donating 3 to 4 times a year, and they would have that on their calendar as something that they did, right? Now, fast forward to recently, and what we're seeing, this has flipped. So now most of the donations that we're getting are voluntary donations, people are directed donations and not voluntary. Right? So when we talk about directed donations, it's replacement, meaning that your mother have to go for a surgery. Yeah. And it is next week Tuesday. So everybody in the family go and donate for your mother, go and give blood because mommy need to have 4 units of blood in the back. Right? Oh. Now, what that does is that creates issues. That creates significant issues. And again, it would be issues that that the layperson wouldn't necessarily recognize. So using the example of going to donate for a family member, mama have to get a hip replacement, everybody go and donate for mama, so all the kids and the cousins and everybody, so mama have 12 units of blood in the blood bank. Or you cannot tell me when mama go up to OKU next week, she don't have blood.
Right.
Because 12 units go inside there. What happens? Big fete over the weekend.
Right.
Big fete over the weekend. Pile up. Accident. Emergencies.
Right.
We cannot, as healthcare professionals, ethically, we cannot, legally, we cannot not use that blood for emergencies.
Absolutely.
Right? So, mama comes on Tuesday, starved, because they tell her don't eat anything for her operation. Sorry, ma'am. We can't do your surgery because we had to use the blood. Cataplex. Everybody making noise. Oh, we give blood and da-da-da. But again,
That's how it works.
that's how it works, right? And because most of what we have is what is given for replacement, we cannot even say, okay, we can still do it because we have there. No, we don't. And that puts off the elective surgery, and that creates a sort of friction between the healthcare services and the public.
Exactly.
Right? Another thing is that as an altruistic donor, as a volunteer donor, because you consider it to be part of your civic duty, you also consider being healthy enough to donate as part of your civic duty.
Right.
And you're more likely to be honest on the questionnaire as part of your civic duty, because you're doing it not because you have to, but because you want to, right?
Yes.
So now when we have the replacement donors it now creates a gray area. Because now, if you, say for instance, you just got a tattoo last month, it healed, but it's last month you got the tattoo.
Right.
You have to go and donate for your mother. One of the questions that we ask is, do you have any tattoos and how long ago? How recent?
You're tempted
right?
to be dishonest.
You are tempted to be dishonest.
Because you want to give the
because
blood
you
for your
want
mom.
to give the blood for your mother, or you feel like you're obligated to give the blood for your mother. Right? Now, what can happen is that you may have contracted something through receiving the tattoo, usually something like hepatitis C. We're still in the window period where even if we test, it could be that we don't pick it up. You put that blood into circulation. And remember, the blood that you donate is not the blood that is used for your family member. Right? You're just putting it in the bank. Somebody else could get that blood. A pregnant woman could get that blood. A child could get that blood. And thus contract an infectious disease, an incurable infectious disease. You understand what I'm saying? Yeah. So those are the types of issues that we're running upon with having to depend primarily on replacement donors. So that is why, yes, this drive that we're having this weekend is so important for the season that is upon us. But more importantly, I want people to understand that and start looking at it as something that you're doing for your country, something that is your civic duty. And adopt it personally as something that, you know what? Like, people donate to charities and I'm doing this. I'm doing this. Yes. I'm going to be a regular blood donor. And by virtue of making that decision, you are having such an impact on so many lives, because 1 unit of blood can be used for 3 different people. You understand? Because when we broke it down into the components, we have the red blood cells, we have the plasma, we have the platelets. 3 different people could have their lives saved by something that you have made the decision to do 3 to 4 times a year. Wow. You understand? So that more than anything is what I want people to take away from the drive, what we are trying to achieve at SLMDA, and in terms of getting people, energized about
changing the
mindset towards donation, right? And seeing it as their civic duty, and helping us, the healthcare professionals, to help them, to help St. Lucia.
I totally agree. So the drive is on this Saturday.
Yes.
At the SLMDA's
Yes.
Area there,
Area there,
the grounds
across in
from the
Tapion, right.
school, right there.
Yeah.
Right, and it's going to be leading by, the physicians are going to be leading, but anybody can come. Right,
Everybody,
can
every
come.
and anybody can come. In terms of like, for people who are wondering, well, do I meet the criteria to come and donate? Does it even make sense to come down there if I know they're not going to take my blood, kind of thing? So in terms of basic eligibility, you just have to be of good health, meaning that you're not sickly. You know what it is when you're sick.
Exactly.
Right?
Exactly.
And if you've had the flu, you've recovered from the flu, is over 2 weeks since you've had the flu, etc., those sorts of things. In terms of age, at least, I think it's at least 17 or 18 years of age. We don't have an upper limit in terms of age. So if you're doing gymnastics at 75 and you want to come and donate, come on down.
Absolutely.
Come on down and donate.
I love
In
it.
terms of weight, you need to be at least 110 pounds.
Okay.
All right. So, I mean, you can't be too skinny, or else, it wouldn't be safe to take a unit of blood from you.
True.
And then, of course, walk with an official form of photo ID. So, like
Right.
your national ID, your driver's
Passport or
license,
something.
passport,
Okay.
something like that. Because we have to be able to trace the unit.
Yeah.
Right? And in terms of health, bare minimum of hemoglobin is 12.5. Right? So there's a little test that we do when you come. We take a drop of your blood and we put it in a little burette. And that test lets us know if you meet the minimum criteria of hemoglobin.
Wow.
Based on how quickly it drops and stuff. Make sure that your pressure is controlled. There's no contraindication per se for people with high blood pressure or diabetes, but that is really dependent on your medications that you're taking.
Okay.
So I'm sure the staff there would be able to go through that with you and, help you out with that.
Wonderful.
Unfortunately, patients who have had cancer, even if they're survivors and in remission, we tend not to take blood from these patients. Also, patients who are known to have hepatitis or HIV.
Certainly.
Even if your disease is very, very well controlled, and we appreciate the fact that you want to give back, we don't take blood from these patients.
Understandably so.
Right?
Wonderful. Doc, you're amazing. Like I said, I could sit with you for a whole day and we can have this conversation on and on and on. But we've come to the end of the show.
Look at that.
Personally, I know.
The time blew by, man.
Totally. That's always the case when you're having a good conversation.
Indeed.
But just to roll back on you on a personal level, you plan to be here. You're going to be here working alongside us for a while, or
Yes. So
now we have you. We might want to give you passport and thing because we kind of like you. We may not want you to go back to Dominica, unfortunately, but for them, but fortunate for us.
Yes.
What is next?
So I mean, for me, I moved here in July of 2022.
You've been here,
I've been here. I've been here for a little while.
Nice.
I work full time at OKU. As a consultant hematologist and oncologist there. And I also have my private practice at Tapio. And I named my private practice after both our countries. So it's called the Sabinia Rose Hemonc Services.
Ooh.
And I named it, and the names come from the names of our two national flowers.
Aww.
So Sabinia carinalis is the national flower of Dominica, and rose is one of the national flowers of St. Lucia.
St. Lucia.
So I felt in order to just kind of epitomize the fact that, it's two of us as one.
Yes.
Right? And how Lucians see Dominicans and how Dominicans see
look
Lucians.
upon we.
Look upon.
That's a bond not to get involved in.
Oh yes,
If
don't come between us.
Don't do it.
Don't do it. Don't do it. Don't do it.
Certainly.
So yes, so I mean, so I feel settled here. It feels very much like home, but different in a way that is still very nice and enjoyable. My daughter has fit in here like you would not believe. If you hear the child talk, you would never know.
Of course, you're right.
You would never know.
That's
So
beautiful.
and my mother is also here with me. She came across
Nice.
and she helps me. I mean, in a way that you can't really put a price on at all. So when
You know what we appreciate? Because just yesterday I was having a conversation. I had to do a little skit for some. No, put all the information out because they got to go for the competition. But we were doing a little skit, and that was like the topic. You know, our professionals, our best, our learned, they're migrating into the world country because you know it's better pay, better this, you know, and then it's like a brain drain. All of our good people. So when we meet persons like yourself, whether you left Dominica but you're still within reach, you're in the Caribbean,
and I see a lot of Dominicans as well.
Yeah, that's appreciated. I appreciate that the fact, you know, whether you remain in the region, I think that serves augurs well for us as a Caribbean people as well, to be able to keep our people, our brilliance and our best. So I'm glad persons like yourself tend to stay, and you know, kudos, and we appreciate everything that you're doing. And you rock, man. I like your energy. Did I say I like her energy?
Yeah, but the vibe there. The
real vibe. This is vibe, man. That is the vibe we were talking about, and I definitely can feel that vibe. So we are honored to have you as part of the fabric of St. Lucia, you and your family. Anything else you want to throw out there? I mean, you gave so many great pointers already for inspiration and motivation, but if there's anything else that you like to drive home, you can definitely do that.
Well, I mean, again, to, you know, just kind of reiterating, the main reason for being here is getting the word out about the blood drive this weekend, but also getting the word out and changing the narrative as to how people see blood donation. Don't see it as a replacement thing. See it as a civic thing, a Lucian thing, right? That you're giving back to the country that has given you so much and will continue to give you so much in terms of culture and love and your people. So see donating in that regard. Change the light, change the perspective, give, right? So that we may all live.
Absolutely. I totally agree with that. You know how we normally do, like a group of girls, we having a girls' weekend. Now that could be something we could do as a team. Yeah, commit to that as a team of girls or a team of guys, you know, a team of friends. Let's commit to it.
Yes, go and donate.
Yeah, absolutely.
Right?
I think that's something to start now. I'm getting ideas. Thank you again, Doc. You're amazing.
Thank you so much for having me.
Wonderful.
Thank you for having me.
Thank you again. All right, guys. Well, that's where we wrap up our show for today. What a beautiful show it was. I could speak to her for the entire day. And I guess you can concur, right? She our vibe. The vibe is right, you know. But unfortunately, we're going to have to do it again next Tuesday, God's willing, right here for another show. I think next week we'll be having I think it's the British ambassador. She's going to be here. She's actually on island, and she will be joining us. So we look forward to that, and you know, just a space where we can, you know, we can share, you know, we can inspire, we can motivate. It is doable. It is doable, and of course, with a program like that, you get to see it all the time. Thank you to the First National Bank. We appreciate you so very much, and let's do it again next Tuesday for another She Speaks. I'm out. I'll be back at 2, God's willing. But Hyper is there. He's coming up next.
All started with a penny. For over 85 years, we have invested in our farmers, fishermen, people, and our country. When we were called to serve, we were here. We understand what is valuable to our people and our country. That is why we support all industries, including tourism. We are the bridge towards a brighter future and economic growth. When our people, government, and businesses called upon us, we were here. 85 years later, First National Bank St. Lucia Limited is here for you.
Established in 1961 and still going strong.
Like, really? No.